You'll hear a loud recording message. One moment. And thank you. You're welcome to start, Dr. Thompson.
Thank you so much. I recommend that as we do our roll call vote, we briefly put our video in place so everyone can see our face, and then turn the video off, because it does significantly impact our quality if we leave our videos on. But I agree with Dr. D'Amico. It'd be great to see everyone's face. As long as you're comfortable, if anyone's not comfortable sharing their video, that's completely fine, of course. All right, so I am calling to order the Naturopathic Medical Committee meeting Tuesday, March 8th, 2022 at 10:01 a.m. And at this point, Rebecca, if you could do a roll call, that would be great.
Absolutely. Thank you, Chair Thompson. Dr. Thompson?
I am present.
Thank you. Dr. D'Amico?
Present.
Dr. Vera Singleton?
Present.
Dr. Deparshi Mukherjee?
Present.
Great, thank you. Dr. Bruce Davidson?
Present. Good morning.
Thank you, good morning. Dr. Mina Yoon?
Present.
Great, thank you. And Ms. Shirley Worrells?
Present.
Good morning, Shirley, thank you. All right, it looks like we have everybody here and we've got quorum.
Wonderful. So at this point, we are going to call for public comment on items not on the agenda. Moderator?
This is the moderator, and I'm going to open up the WebEx's Q&A feature, which will enable you to click on the Q&A box, usually in the lower right-hand corner of your screen, or if you're on a mobile device, it's behind the three-dot other options. And in the text box that you find there, you can type the word comment and send, and that way we will know that you'd like to make a comment. We will take comments in the order received, and each person will have 3 minutes to speak. And I do not see any requests for comment at this time. Shall I close the Q&A feature?
Please do.
Thank you.
Okay. At this point, we are moving on to agenda item 3, which is introduction of new committee members or member. So we do have a new committee member, Dr. Mukherjee. We're so happy to have you. I'm going to briefly read your bio here for those who haven't seen it. On February 3rd, 2022, Governor Gavin Newsom appointed Dr. Deparshi, I'm so sorry, Mukherjee, Doctor of Osteopathy, to the Naturopathic Medical Committee. Dr. Mukherjee received his undergraduate degree in biology from Rensselaer Polytechnic Institute and a Master of Science in Education in Sports Medicine from the University of Miami, Florida. His osteopathic medicine degree from Nova Southeastern University. He completed his internal medicine residency at the University of Florida and sports medicine fellowship at the University of Maryland. He has worked with a high-level college Division I teams at the University of Miami, Florida, the University of Maryland. He's also worked with the NFL's Jackson Jaguars, Baltimore Ravens, and the MLB's Baltimore Orioles. He worked at the 1996 Atlanta Summer Olympics and the professional ATP tennis tour as well. Presently, Dr. Mukherjee is an internist and sports medicine specialist at Kaiser Permanente. He has been with the Permanente Medical Group since 2004. He has served as the Chief of Pain Medicine and as Adjunct Clinical Professor at Touro University of Osteopathic Medicine. At present, he is a regional opioid lead for the Northern California Kaiser Permanente and also the local lead for pharmacy and therapeutics. He also works as a community consultant for his local physicians. He is a member of the National Kaiser Permanente Controlled Substances Work Group to develop strategies to manage opioid and benzodiazepine care at Kaiser Permanente. For 17 years, he's provided comprehensive primary care and wellness to thousands of patients in a large and diverse metropolitan community. He places a focus of holistic and preventative care for all of his patients. He believes in helping patients lead healthier and more active lifestyles through exercise, proper diet, and a positive outlook. And most importantly, he's involved in martial arts and enjoys travel, reading, and being outdoors. Please join me in welcoming Dr. Mukherjee to our committee. In reading this bio, Dr. Mukherjee, I am so excited to have you. I can see so many skills that you have that are going to greatly benefit our committee.
Thank you so much. Thanks for the warm welcome, and great to be on board and great to learn from everyone. And thanks so much.
Wonderful. And we also have one of our public members, Dr. Bruce Davidson, has been reappointed. We're thrilled to have you continue with us, Bruce. Your insight and intelligence is really, indispensable. As many of you already know, Bruce has a PhD in health policy and health services research, master's degree in population and family health, 40 plus years experience in health services, delivery and evaluation. He is so incredibly dedicated and has really provided an insight for us on data and analysis that is just continues to be just incredibly helpful for our committee. Welcome back, Bruce.
Thanks, Tara. I'm so happy to be reappointed and glad that I can contribute. Look forward to the upcoming future. Thanks again.
Great. All right. We're going to move on to agenda item number 4, which is the review and possible approval of committee meeting minutes. And we have 3 different committee meeting minutes that were sent out. Those are from October 2021, November 2021, and December 2021. Have people had an opportunity to look over those? And does anyone have any comments or corrections?
This is Dr. D'Amico. I had a couple of small typos.
Great. If you could just give us those.
I have many documents open, so let me go backwards. On December 2nd, agenda item 4, second sentence. I marked it up and I don't know how to see what was there. It says something besides the community. I think it says their committee. It should say the committee. Okay.
Are you able to see that, Rebecca?
I'm looking, and you said it was agenda. Oh, I see it. Yes, I do. I will make that change. Thank you.
Okay. And then on 10/5/21, agenda number 5, last sentence of the second paragraph should read, the report will provide a snapshot and substantive information.
I'm sorry, which section is this under? Is this on the draft minutes for October 5th?
Yes.
Okay.
Yeah.
And under agenda item what?
5.
5. Thank you. One moment. Okay, go ahead.
A second paragraph, last sentence, the report will provide, should say, a snapshot and substantive information.
Okay.
And I think there was a little one on 11, just have to find it. On 11:17.
Okay.
Agenda item 4, first sentence should read, provided the committee members with a draft copy.
Perfect. Got it.
Nothing serious.
Yeah, perfect. Thank you so much. And I will make those changes. So let's go ahead and go back.
Are there any other edits or changes from any of the people present?
I don't see any other hands raised.
Yes. So based on that, we are going to move forward with approving these meeting minutes with those changes. Do we need, Rebecca or Sabina, do we need to approve those one at a time, or can we approve all 3 of them at once?
This is Sabina. As long as your motion states the dates of the minutes and also the noted amendments, then we can do it in one motion. And as a reminder, members who are not present at those meetings can still vote to approve or not approve those minutes.
Thank you so much. I am going to motion that we approve the meeting minutes for October 5th, 2021, November 17th, 2021, and December 2nd, 2021, with the edits that we have just noted.
This is Shirley. I second that motion.
Wonderful. Rebecca, can you take a roll call on that?
Wonderful. Thank you. So I have a motion from Thompson and a second from Worrells. Dr.
We
Dara
need
Thompson.
public comment. Sorry.
You're right. Sorry.
Moderator.
We need public comment on this motion, and then we can go back to our roll call vote.
So this is the moderator, and we've opened for public comment. This is accomplished through the Q&A feature of WebEx. It's the icon with a question mark, usually in the lower right corner of your screen, and you can type the word comment into that question box and hit send, and commenters will be recognized in the order received. Each person will have 3 minutes to speak. I'll give people a moment to locate that. If you are using the mobile device, the Q&A is behind the 3 dots, other options. And if you are calling in, you can hit *3 to raise your hand, and that will serve as your request. I do not have any requests for comment at this time. Shall I close the Q&A feature?
Yes, please do.
Thank you.
All right. So at this point, we are moving on to our roll call vote. Thank you.
Great. Thank you. So we have a motion from Thompson and second from Worrells. Roll call vote. Dr. Thompson.
Aye.
Dr. D'Amico.
Aye.
Dr. Singleton.
Aye.
Dr. Mukherjee.
Aye.
Dr. Davidson.
Aye.
Dr. Yoon.
Aye.
Ms. Worrells.
Aye.
Great. Thank you. It looks like we have 7 ayes, and that passes.
Wonderful. At this point, we're moving on to agenda item number 5, which is discussion of the Intravenous Therapy Specialty Subcommittee. Rebecca, if you could give us a brief overview of the subcommittee and then also remind us who the current members are.
Great, thank you. So the background for this information for the Intravenous Therapy Specialty Subcommittee, in 2012, SB 1446 McLeod was enacted allowing naturopathic doctors to furnish nutraceuticals, vitamins, amino acids, and minerals, among other substances as specified, and to be independently prescribed and administer epinephrine and hormones. The bill further authorized NDs to administer intramuscular, intravenous, or other specified routes only when such substances are chemically identical to those for sale without a prescription. The bill required NDs to demonstrate that they complied with specific requirements, including the successful completion of specified coursework by approved providers by the committee. Lastly, the bill created the authority for the committee to establish regulations regarding IV administration and that are consistent with the education and training of a naturopathic doctor. Since that time, NDs who have met the training requirements have been afforded the opportunity to provide IV therapy to their patients. However, there are currently no established regulations on the standard of practice for this treatment approach. Due to the adverse events surrounding IV therapies by an ND, the San Diego District Attorney's Office recommended that regulations be promulgated for the safe and effective use of IV therapy by NDs. During the November 15, 2018 committee meeting, it was determined that a subcommittee should be formed to assist in establishing regulations that meet the best practices and standards regarding the use of the IV therapy. On May 6, 2019, the subcommittee convened and started the work of producing the recommendations for the committee. However, after the September 20th, 2019 meeting, the subcommittee lost its physician representation when Dr. Miles Spar resigned from the committee. The subcommittee provided their recommendation to the committee, and the committee approved those proposed language. In early 2020, the regulatory package was started. However, during the August 30th, 2021 meeting, there were members of the public that had objections to the proposed language, and the package was pulled for further work. In preparation for the committee sunset review, the committee pended reconvening the subcommittee until the committee could focus their efforts on ensuring that all areas of concern were addressed and corrected. The proposed action and recommendation: the subcommittee should examine the education and training of accredited naturopathic medical colleges, current standards for IV therapies, and the ND scope of other regulated states in an effort to develop regulation language that closely matches to the ND education, training, and standards of practice and provides the most robust protection for the public. Currently, the prior subcommittee members for this were Dr. Thompson, looks like Shirley Worrells was on here, and then Virginia Osborne was a consultant. And I also wanted to just give you guys some information that we recently received an IV training provider request from Genesis Medical College. They would like to be one of the approved providers for the IV therapy training. This was received too late to include a review today, but I will actually be placing this on a upcoming meeting for you guys.
And Rebecca, one of the other things we should probably place on that upcoming meeting would be discussion of the new parenteral therapy exam, which is available through the NPLEX.
Will do. Thank you.
This is Dr. Singleton. Just a correction that I am on the IV subcommittee.
Yes, I thought it was Dr. Singleton and not Shirley Worrells, but am I incorrect on that?
You know what? I may have done that incorrectly. I will go back and look at the books. Hold on one moment.
This is Shirley Worrells. I think she is correct on that.
Thanks, Shirley.
Yes, I am so sorry about that. That is my mistake. Yes, it was Dr. Thompson, Dr. Vera Singleton, and Dr. Virginia Osborne as a consultant. I will make my change.
So on our agenda, we have the discussion of adding new members to this committee. It certainly would be highly beneficial for us to do so. Rebecca, can you remind us the process for that?
Sure, you can, as the chair, can appoint anybody to a subcommittee as long as they're willing to accept. If we keep it at 3, then 2 members can always work ad hoc items without calling a total meeting for the subcommittee. But once the 3rd person is involved, then we would have to do a notice for public hearing.
And is this a situation in which we are advised or required to have a physician member on the subcommittee, or is that not necessary?
For the Iv Therapy Subcommittee, it is not necessary. However, if you guys would like to have an MD or DO on this, we could do that.
Okay. I think since we're for Dr. Mukherjee, these are new to him, and we want to allow him time to decide if he wants to be on one of these subcommittees. We should actually discuss the minor office procedures subcommittee and then look at the composition of those subcommittees. Are we able to do that, or does that diverge too much from the agenda?
No, I think that should be fine. Sabina?
Yes, this is Sabina. Absolutely. You can always take agenda items out of order. You can describe each subcommittee and their makeup, and then you can also just take volunteers of who would like to be on each committee first, and then you can make those appointments official, and then see if you need to, talk anybody into joining any of the other committees.
Right. So what I wanted to do was discuss the 2 subcommittees, see if the existing members want to remain on those committees and if anyone else wants to join those. So if that works for everyone, I'm going to have Rebecca also go over the overview of the minor office procedures subcommittee.
Great, thank you so much. So the background for the minor office procedure is in 2005, the Naturopathic Medicine Committee, formerly the Bureau of Naturopathic Medicine, was directed by the legislature to consult with physicians and surgeons and licensed naturopathic doctors in order to develop findings and recommendations regarding the development of scope and supervision requirements of a naturopathic doctor for the performance of minor office procedures. At that time, the Bureau consulted with 2 naturopathic doctors, 2 emergency room physicians, and an interested member of the public. These consultants unanimously agreed upon the findings and recommendations presented in the 2007 Findings and Recommendations regarding minor office procedures report, and that report can be found on our website. Unfortunately, the original intent of the legislature was not acted upon, and the Naturopathic Doctor Act continues to be extremely limited in the scope compared to the education and training of naturopathic doctors. Due to the restricted scope of practice, naturopathic medicine in California falls short in comparison to the other regulated states and territories. With the shortage of primary care physicians, allowing California NDs to practice as trained seems in line with Governor Newsom's plan of expanding access to health care. The proposed action is that the committee determine that the original report is outdated and should be re-examined to ensure that the legislature intent to bring the ND scope in line with the most current education and training is met. During the November 15th, 2018 committee meeting, it was determined that a subcommittee should be formed to examine the current education and training of NDs in regard to performing minor office procedures. On April 9th, 2019, the subcommittee convened and started the work of producing the recommendations for the committee. However, after September 20th, 2019 meeting, the subcommittee lost its physician representation and had to stop its work. It is recommended that the committee reestablish a subcommittee that subcommittee should examine the education and training of accredited naturopathic medical colleges, the current minor office procedures included on the naturopathic physician licensing exam, and the ND scopes of other regulated states in an effort to develop a scope that equates to the ND's education and training. Furthermore, the subcommittee should conduct an open discussion about the changes needed to be made to the 2007 findings and recommendations regarding minor office procedures report. The prior subcommittee participants were Greta D'Amico, Miles Spar, and Bruce Davidson.
Thank you so much, Rebecca. I have a comment and a question. This is Dr. Thompson. The first is just for those members of the committee that are not aware, minor office procedures are part of the education of naturopathic doctors at all of the naturopathic medical colleges. And there is an elective board exam specifically for minor surgery that graduates can take as part of their board exams. The question is this a committee that does require a physician member, MD or DO member?
Yes, it does.
Okay, thank you so much. So at this point, I just want to ask the committee, the current subcommittee members, to state if they are able and willing to remain on those subcommittees. That would be myself and Dr. Singleton for the IV Therapy Subcommittee, and Dr. Yoon and Dr. Davidson for the Minor Office Procedures Subcommittee. I will start out and say that I am willing to stay on the IV Therapy Subcommittee. Dr. Singleton?
I'm sorry, this is Dr. Yoon. Can I make a comment?
Absolutely.
What about the Formulary Committee?
I believe that committee completed its the work that it needed to do, and its recommendations are currently in place. Is that correct, Rebecca?
So the formulary was produced. We have not done anything with it yet because we stopped all of the subcommittees and we wanted to make one report that goes to the legislature with all of these in it. But the formulary subcommittee did come with their final formulary. If you would like, I can make sure that everybody gets a copy of that formulary.
Okay, that sounds great. Thanks.
Sure, thanks.
So they're waiting. This is Dr. D'Amico. They're waiting for what? The Formulary Committee?
So what Rebecca said is that because this is clarification of our existing law, all of these subcommittees, that we were waiting to have reports from each of the subcommittees and send them all together. Is that what you just said, Rebecca?
Yes, for the minor office procedure and for the formulary independent prescribing, that is correct. IV therapy is totally separate from these two issues.
Okay, and I'd like to correct, you said Dr. Yoon was on the minor office procedures. It's actually me, Dr. D'Amico, and Bruce Davidson, as Rebecca said, and I'm willing to continue.
Thank you so much. I apologize for that.
This is Dr. Singleton. I'm also willing to continue on the IV subcommittee.
Thank you so much. Dr. Davidson?
Yes, I'm willing to continue on the minor office procedure subcommittee.
Great. So at this point, we are looking for a couple more people for these committees. Would anybody be interested in working on these committees? Certainly, Dr. Mukherjee, no pressure, but you are currently our one DO member, and we would love to have you on the minor office procedure subcommittee to fill that space. But if you don't feel comfortable doing that at this point, we totally understand.
Oh, hi, this is Dr. Mukherjee. I'm happy to be involved with the minor office procedure subcommittee. Definitely, I think you need me to get moving on that. So happy to be involved.
Thank you so much. Rebecca, do we need a third member for the IV Therapy Subcommittee at this point? Because we were consulting with Dr. Osborne externally.
That is correct. And I'm sure that if we reach out to Dr. Osborne, she would still be willing to provide consultation for that subcommittee. If you and Dr. Singleton wanted to remain on the subcommittee, then I think we'd be fine. If Dr. Thompson, if you do not want to remain on this and somebody else wants to jump on, that would be okay as well.
I am comfortable remaining on it, but am also happy to have someone else join if they would like to. Anyone who's interested, you can let me know. And this is also something we don't have to necessarily assign these subcommittee. Do we have to assign these subcommittee members during a meeting, or can that be done at any time?
It can be done at any time.
So if you want to speak to me or Rebecca separately, we're happy to do that. We can always adjust that later.
Right, that is correct.
Great. And then again, with the IV Therapy Subcommittee, we have very clear language in place, but some significant issues were brought up at an earlier meeting, and we do need to go back and reassess those and make sure that the wording, it's mainly an issue of wording that we need to go back and reword things appropriately. So that is the major work of that committee at this point.
That is correct, yes.
Okay, great. Seeing no volunteers for that committee at this time, I think we should leave it as is for right now. And certainly if someone wants to join, please do let me know. Just contact myself or Rebecca, and we're always happy to have more input. I would love to appoint Dr. Mukherjee to the Minor Office Procedures Subcommittee. I think you'd be really, given your bio, really valuable addition to the subcommittee, and we'd love to get that moving forward so that we can get those recommendations sent off. Thank you so much.
Thank you,
All
Dr.
right.
Thompson.
Yes. Do we need to ask for any public comment at this point?
This is the moderator, and Dr. D'Amico has her hand up.
Oh, I'm so sorry. I didn't see that. Dr. D'Amico.
Oh, yeah, I just wanted to clarify that we now have the green light for all these subcommittees to move forward in their work, correct?
That is correct.
Awesome.
This is Sabina. You're welcome to always ask for public comment on every agenda item. You can combine these for public comment on both items 5 and 6 on the subcommittee and the subcommittee assignments.
Thank you. Then I would like to call for public comment at this point, moderator.
And this is the moderator, and we are opening up the Q&A feature of WebEx. In case you would like to make public comment about either of the two subcommittees. And if you would like to make a comment, click on the question mark inside a box. And we will recognize people in the order received. You would type the word comment in the text box and click send. If you're on a mobile device or on a call-in on a phone, you can raise your hand by hitting *3. And I do not see any requests for public comment. Shall I close this feature?
Yes, please do.
Thank you.
All right. So it's time for our executive officer's report. So Rebecca, I'm going to turn that over to you. Thank you.
Great, thank you so much. Today I will be reporting on the licensing and enforcement statistics, just going over some committee member training, Form 700 conflict of interest information, box account information for sharing confidential documents, and the executive officer evaluation process. All right, I'm going to start with the licensing report. Thank you. This table shows the number of licensees participating under the committee's jurisdiction currently. The NMC's total licensee count as of as of March the 4th is 934 active and current licensees, 28 in an inactive and current status, 195 are in a delinquent status, 146 are either other retired or in a canceled status, putting 1,304 jurisdiction. All right.
This is Dr. D'Amico. Rebecca,
Yes.
would you be kind enough to explain what the category of delinquent means for the sake of our new member?
Absolutely. So we actually have it in our statute and regulations that a grace period of 3 years is provided to our licensees. Once they go into a delinquent status, they have 3 years to come back into an active status and pay all of the back renewals and late fees. If they do not choose to reactivate or renew their license within that time, then after the 3rd year, the license becomes automatically canceled within our system. And if the licensee wanted to become licensed again, they would have to reapply and go through the processes of applying just like a new licensee would. So unfortunately, they will stay in a delinquent status on our website. And if anybody looks them up, it will show that they are delinquent for 3 years.
And this is Dr. D'Amico. I believe we have a request to create one or two new categories, retired and what would be the other one, Rebecca, in our sunset review. So this will be more clear in the future.
Right. So we actually have, we don't have a retired status right now. We have been allowing members that want to place their license in a retired status to advise us that that is what they want to do, so that once we get our our regulations, that we can go ahead and have that process in place to do so for them. And for our our inactive, we already have the regulations for an inactive status. However, the inactive status currently requires them to pay the whole renewal fee of an active license in order to renew as inactive. We are right now trying to make changes to our regulations that will allow an inactive member to renew at a discounted fee. All right. Are there any questions about the licensing statistics at this time? All right, great. And I can tell you that right now, our licensing timelines, we have 30 days to process a initial application. Our staff is currently doing it within 8 days. And for the initial license, which means that the applicant will pay their license fee and become licensed, we have 45 days to do that, and we are also doing that within 3. So we are really well within our timelines for processing for licensing. So shout out to my staff that takes care of licensing for us.
You just said licensing in 3 days, Rebecca?
Yes. So the initial license where they pay the fee, and after their application has been reviewed and approved, it's taking 3 days to process a new license for them.
Well, that's definitely a record. That's amazing. Thank you.
Absolutely. Thank you, Dr. D'Amico. All right. Were there any other questions about the licensing stats? Okay, I don't see any hands, so I'm going to go ahead and move along to the enforcement report. All right, currently the NMC has 97 total enforcement cases open. Of the 97 cases, 37 are against licensees, 1 is against an applicant, while the remaining 59 cases are against unlicensed individuals. The unlicensed activity continues to remain the largest portion of the NMC's enforcement caseload, making up 61% of the cases. We hope that continued educational and informational outreach campaigns will assist in continuing to reduce the unlicensed activity. Unlicensed activity consists of the following: using the naturopathic doctor or the ND title, not providing a written disclaimer of unlicensed practice to their clients, and having a signed copy of the client on file per California Business and Professions Code Section 2053.6, and or providing diagnosis in violation of California Business and Professions Code Section 2053.5. Advising their clients to discontinue medications prescribed by a licensed healthcare provider, also prohibited with California Business and Professions Code Section 2053.5, providing treatment within the scope of an ND, or harming clients. We have had 10 new cases since our last meeting. Although no cases have been closed, we have had many cases that have been resolved and are awaiting closure. We had a temporary analyst working on getting these cases completed and closed, while others may be forwarded to the Division of Investigation for further investigative efforts. However, the temporary help ended as of January 10th, 2022, and as of February 1st, our permanent analyst came back full-time and will be working to get these cases processed on a priority basis. 3 cases are pending submission to the AG's office. 4 cases against unlicensed individuals are pending submission to the District Attorney's Office for criminal charges. Are there any questions about the enforcement report? All right, Dr. D'Amico.
Hi, this is Bruce. I had a question.
Sure, Dr. Davidson, go ahead.
Thanks very much for going over that. I wasn't able to tune in to the hearing yesterday, and I guess is this okay for me to ask whether there was any discussion or commentary of interest with regard to enforcement at the hearing yesterday?
Very minimal. They did ask about the amount of the unlicensed activity that we have. They were also had some questions about the lack of formal discipline that goes to the AG's office. And we just, had to advise them that between the time period that they were requesting the report information and data, that there were no cases that had moved forward to a formal discipline at the time. Not saying that there aren't any that need to go now that we had at that time, but at the time that snapshot was taken of the data, we did not have any that were moving forward at that time. So yes, there was some interest, and I believe that we provided a response that was sufficient to them. There were no follow-up questions for those.
Great, thank you very much. I appreciate the recap.
Very, very welcome. Thank you so much. And Dr. D'Amico.
Yes, on the previous slide, I thought you said there was currently 1 case of an applicant. Is that correct?
That is correct, yes.
So it says 4 on here?
There's 4 altogether, but there's 1 new applicant case.
Okay.
Sorry, and I'm sorry. Thank you so much for asking that clarifying question. All right, and if we can move forward to the next slide, please. Thank you so much. Oh, no, back 1, please. Thank you so much. All right. Now we will review the violation types that make up enforcement cases against our licensees and applicants. Currently, the NMC has 38 total enforcement cases open on ND licensees, 37 against licensees, plus the 3 applicant cases, coming up to 4. Of those 38 cases, the breakdown of violation types are as follows. Advertising violations are 7 or 18%. Failure to update addresses with committee, 3 or 8%. Substance abuse related violations, 4 or 11%, unprofessional conduct, 16 or 42%, records only, which is for not releasing upon patient request, is 5 or 13%, and patient harm, not including any patient death, is 3 or 8%. Are there any follow-up questions on the enforcement report related to licensing?
Rebecca, can you clarify the unprofessional conduct category since it's 42%?
Sure. So unprofessional conduct would be making statements that are maybe not, so it's stuff that is just too egregious to be under advertising. So if we had something on somebody that may have been providing misinformation about vaccines or something like that, they would actually be put under unprofessional conduct instead of under advertising. Other unprofessional conduct would be if a licensee isn't providing treatment or stops care of a treatment without providing any transition for them. Stuff like that is considered unprofessional conduct.
This is Dr. D'Amico. Just to be clear, when we're reading the report, this is cases that are open and alleged but haven't necessarily been investigated or concluded and decided that this is actually what happened. Is that true?
That is correct, yes. These are just allegations. All right, are there any other questions? All right, seeing none, I will go ahead and move forward to the committee member training. All right, so there are always a couple of training items that the board members or committee members will have on different times of the year or different years, depending on whether it is a mandatory year or not. For the board member orientation training, or BMOT as we like to call it, the board members are required to complete the BMOT within 1 year of appointment or reappointment. BMOT will be offered as a live virtual training. It is a whole day long, and the next one is on March 9th, another for June 15th, and another scheduled for October 12th, 2022. Members can register through the Department of Consumer Affairs Learning Management System, or LMS. BMOT is required for newly appointed and reappointed members, but is also available as a refresher for all members and executive officers. Reach out to myself or to the Board and Bureau Relations with any questions on that. It looks like we have member Davidson scheduled for the March 9th BMOT, and we have member Mukherjee scheduled for the June BMOT. Updated mandatory trainings for 2022. The DCA has updated mandatory trainings, which are now available through Solid's Learning Management System. Sexual harassment prevention, beginning in 2022, there are 2 separate trainings, one for supervisor and one for non-supervisors. So we will make sure that you guys are scheduled to take the correct sexual harassment prevention training. There's a new 2-hour 2022 and 2023 supervisory sexual harassment prevention training for DCA leaders, including managers, supervisors, and board members. So that is a new one this year. So we'll be making sure that we have you guys scheduled for the correct one. All new DCA employees, appointees, consultants, and SMEs are required to complete the training in 2022. Existing DCA employees or board members who did not complete sexual harassment prevention training in 2021 are also required to complete the training required for their role in 2022. Ethics training is approximately a 2-hour training. Board members are required to take an ethics training course within the first 6 months of appointment and repeat this ethics orientation every 2 years throughout their term on the committee. The training is online, interactive, and can be completed at your convenience. Defensive driver online training is about a 2.5-hour training. All state employees and board and committee members who drive a vehicle on official state business must complete the Department of General Services approved defensive driver training course at least once every 4 years. The training is online, interactive, and can be completed at your convenience as well. If you guys have any questions about who needs what training this year, please offline, just send me an email and I will let you know when your last trainings were and if you are required to take them this year or not. Are there any questions on the trainings? Wonderful. Seeing none, I'm going to go ahead and move forward to the Form 700, Conflict of Interest. All committee members need to file their Form 700 Conflict of Interest statement within 30 days of assuming their appointment position, annually by April 1st, and within 30 days after leaving their appointed position. If you have not completed your annual statements, please do so as soon as possible. If you have questions, please let me know, and I will provide you with the DCA's Conflict of Interest Filing Officer's Jill Johnson's information offline. And for new members or reappointed members, just make sure that you have completed your assuming position statement. Are there any questions about the Form 700? Wonderful. Moving right along, we'll go to the box account for sharing confidential documents. DCA has set up a new platform for us to be able to provide the sharing of confidential documents. And this is going to be for certain enforcement cases that we need to provide to you when it comes to disciplinary actions and that type of thing. So this is a way for the committee and the committee members to share this information and to ensure that it's not getting out anywhere that it's not supposed to be. So I just wanted to kind of bring that to your attention as we will be using that in the future. So I will be sending more information out as we start using it. Are there any questions about the box account? All right, seeing none, I'm going to go ahead and move along to the Executive Officer Evaluation process. The Business and Professions Code provides the committee with the authority to employ an executive officer. The executive officer is a non-civil service exempt employee who serves at the pleasure of the committee. The EO is responsible for carrying out the policy directives of the committee members, directing activities for the committee staff, and working effectively with the Department of Consumer Affairs. It is crucial for the committee, with the input from the DCA, to evaluate the EO's performance annually and set expectations for the following year. A revised performance appraisal form was revised in October of 2020 and will supersede any prior versions, and it should be used from here on out. The revised performance appraisal form provides committee members with DCA's leadership team an opportunity to evaluate the performance of the EO in a fair, impartial, and transparent manner. DCA's leadership team may include feedback from various DCA divisions that the EO interacts with during the course of employment. DCA encourages all committees to conduct the annual EO performance appraisal in the months of October through December at a publicly noticed committee meeting. As we get closer to the third quarter meeting dates, the chair will work with DCA to prepare for this year's EO evaluation. Are there any questions about this? I know that we've been a little backed up and we haven't done this in a while. And I had some specific requests to put this onto our agenda this time around so that we don't miss the evaluation again this year. I see that Dr. D'Amico has a hand raised. Go ahead, Dr. D'Amico.
So I think we did not do this at least last year and maybe not the year before. Does that just go by the wayside and we just try to catch it next time around?
That's correct. Yeah, we've just been so slammed with, business of the committee that we just haven't gotten around to it. I know that when we started into the whole pandemic, just a lot of the stuff that we were normally doing was just not effective. So we just weren't able to get to it. I mean, I know that there were a couple of times in the past where we did the EO evaluation and there were suggestions for raises and that type of thing, and it just didn't happen. So I think some of the committee members were a little disappointed about that, but it is just the way that it kind of falls sometimes. So regardless of whether there's any additional salary increases or anything like that, an evaluation process should still be done every year.
So it'll be on an agenda for our fall meeting, right?
That is correct, yes.
Thank you.
Thank you so much. Are there any other questions? All right. Well, thank you so much. Let me go ahead and I will mute myself and we can go ahead and move forward.
Thank you, moderator. I see that you are opening for public comment.
Exactly. If anyone would like to comment on the items in the executive officer's report, you may look for the Q&A icon, which is a question mark inside a box at the lower right corner of your WebEx screen, or behind the 3-dot other option if you're on a mobile device. Or if you would like to comment and you are a call-in user, you can hit *3 to raise your hand, and we will take commenters in the order received. And I do not see any other requests for public comment. Shall I close this Q&A feature?
Yes, please.
Thank you.
I apologize. I'm not sure if an intro was made, but can everyone hear me?
Yes, hi. Thank you. This is Dr. Thompson. I was speaking, but I was muted. I apologize.
Oh, okay.
Yeah, so I was just saying that I just want to let the committee members know that we are definitely planning to have a break, prior to lunch, but that we haven't been in session for a full hour yet. So we're going to move on to our DCA update. Thank you so much for being here, Brianna Miller. Welcome.
Thank you. Thank you. And sorry for jumping the gun there. I got nervous that I couldn't hear you and everyone was waiting on me. So, but thank you all for having me. So with that, as Chair Thompson mentioned, I'm Brianna Miller with the Department of Consumer Affairs as Board and Bureau Relations. Thank you for allowing me an opportunity to provide a department update to you today. And before I get started, I'd like to welcome Committee Member Mukherjee. Congratulations on your appointment and thank you for your service to California consumers. And congratulations also to Committee Member Davidson on your reappointment to the committee, and thank you for your continued service to California consumers. So I'd like to start my report with an update on COVID-19 safety measures. DCA appreciates all board, committee members, and staff who have continued to serve through a pandemic that has affected all of us in so many ways. As California moves past the recent Omicron surge and into a new endemic reality, new state public health guidance has relaxed mandatory face coverings. Masks are still strongly encouraged in indoor settings, and in some high-risk settings, such as healthcare facilities, mask coverings are required for everyone regardless of vaccination status. Local orders may be more restrictive to respond to community conditions, so please be aware of changing public health guidance and remember that as state representatives, we are all expected to adhere to state and local orders while carrying out our duties. Moving on to an update on remote meetings. On January 5th, Governor Newsom signed an executive order that extends the sunset date in AB 361, allowing boards and committees to meet remotely through March 31st, 2022. And I'm happy to report that on January 31st, Assemblymember Quirk introduced new legislation, AB 1733, which would permanently allow boards and committees to meet remotely while also providing both virtual and physical options for members of the public to participate. If this bill is passed by the legislature and signed by the governor, it would take place immediately. Next, a note about vaccination verification for in-person meetings. Well, since we cannot be certain that AB 1733 will be enacted or when, boards should and committees should prepare for the possibility of in-person meetings after March 31st. Before any in-person meetings, members must verify full vaccination with DCA's Office of Human Resources or participate in COVID-19 testing. If any members have not yet done so, please submit your proof of vaccination. Your participation will assist DCA in planning for testing at future meetings. Please do this as soon as possible and don't hesitate to reach out if you need assistance. And I am optimistic about the future and I look forward to seeing you all in person one day. Moving on to a note about appointments and recruitment. Whether meeting remote or in person, DCA wants to help keep your committee fully seated with excellent members and diverse voices. Currently, the committee has 2 vacancies, 1 licensee and 1 physician surgeon. Both seats are appointed by the governor. DCA's communications team recently released a new communications toolkit to assist boards and committees with member recruitment, and it's available in multiple languages. Likewise, committee members and stakeholders can also encourage individuals who are interested in appointment to visit the Board Member Resources Center, which is located on DCA's webpage, dca.ca.gov, to apply for an appointment. So now I'd like to transition to some updates from DCA, starting first with the Regulations Unit. The department's Regulations Unit was created in 2020 to address the regulatory needs of the department's boards, bureaus, and committees and commission, while also improving the quality of the regulations. Prior to the unit's establishment, the department's boards and bureaus completed just 18 regulations in 2019. But after the unit was established, it delivered immediate results. The department more than tripled the number of regulations it completed in 2020 and 2021. And unlike prior years, none of the regulations were rejected by the State Office of Administrative Law. The unit, now in its 3rd year, will continue to build on the success of the first 2 years and anticipates completing even more regulations this year. The unit has created new management tools that will continue to improve the process and help track from start to finish every regulation that will be completed this year. So there's more complete transparency in the process. The department is looking forward to working with your committee on another productive regulatory year. And next, an update on DCA's Enlightened licensing project, which is a bit of a tongue twister for me. So I'd like to first provide an update that this work group was formed in 2020 to utilize licensing subject matter experts within the entire DCA. The group's purpose is to help individual boards and bureaus streamline and make their licensing processes more effective and efficient by utilizing best practices, information technology, and cost-saving measures. The first deep dive, which was conducted for the Board of Registered Nursing, has completed. A report will be released this month with recommendations that can be used by all boards and bureaus to improve their processes. And after this successful first round, the work group will soon begin directly assisting another board or bureau. Next, I'd like to introduce DCA's new Compliance and Equity Officer. As DCA looks toward the future, Director Kirkmeyer continues to lead the department toward continual improvement and excellent service. DCA is pleased to announce that Tanya Corcoran began serving as the department's first Compliance and Equity Officer, effective last week on March 2nd. Ms. Corcoran brings years of hands-on experience with DCA boards and bureaus to this new position, most recently having served as the Chief Deputy Registrar at the Contractor State License Board. This position will oversee DCA's solid training and planning solutions, Organizational Improvement Office, Equal Employment Opportunity Office, and the Internal Audits Office. Bringing these offices together under Ms. Corcoran's experienced leadership will be a tremendous benefit, allowing DCA to better identify and analyze emerging issues department-wide and provide timely solutions to DCA's divisions, boards, bureaus, and committees. And finally, a reminder about required board member trainings in Form 700. And I know that Executive Officer Mitchell just touched on this, so I promise I'll be brief. But the reminder is that you as committee members have training and reporting requirements. Each year, as mentioned, members are required by law to file a Form 700 before April 1st or face penalties from the FPPC. DCA requires that you file as soon as possible, and as a tip, I'll let you know that the best way to avoid my reminder emails and phone calls is to file early. If anyone needs assistance, DCA's filing officer and legal counsel are available to help. And additionally, as EO Mitchell mentioned, some of you are registered to attend the board member orientation training this year, and we look forward to having you join us. Board and committee members who were recently appointed or reappointed need to take the board member orientation training within 1 year of that appointment date per law. But of course, this training is available to anyone who seeks a refresher. And as Executive Officer Mitchell mentioned, live virtual trainings will be held tomorrow, March 9th, June 15th, and October 12th. So as always, Board and Bureau Relations is here to help you and your committee. And if there's anything we can do to assist you, please do not hesitate to reach out. So that concludes my presentation, and I will hand it back over to Chair Thompson. Thank you.
Thank you so much for being here. We really appreciate having you. And that's all extremely helpful. Do we have any public comment at this point?
And this is the moderator. I am opening up the Q&A feature of WebEx to facilitate public comment. If you have any comment on the DCA report, you can look for the question mark icon in the lower right corner of your WebEx screen or behind the 3-dot other options if you're using the mobile device. And then type the word comment into the text box and click send. We will take commenters in the order received, and each person will have 3 minutes to speak. And if you are a call-in user, you can hit *3 to raise your hand. And Rebecca Mitchell.
This isn't a public comment, but while we have Brianna on, I just wanted to give a kudos to her. She is with, like you know, the Board and Bureau Relations, and she is always so responsive to us when we need something from her. So thank you so much, Brianna, for always being there for us and having the continued support and leadership. You guys are great over there, and you in particular are always extremely responsive and gracious. So thank you so much.
Thank you, Rebecca. It's always such a pleasure working with you and your committee. So thank you so much for those kind words.
And I do not see any requests for public comment. Shall I close the comment feature?
Yes, please do.
You're okay.
All right. At this point, we are going to move on to our budget update. Welcome, Renee Milano, Budget Manager at DCA. Thank you.
Oh, and thank you to the committee for allowing me to speak today. My name is Renee Milano. I'm the manager overseeing Naturopathic Committee's budget. And today I was hoping to provide you a nice general overview of both your expenditure projections, your revenue projections, and just your general fund condition. So those are going to be based off of the agenda item 9 attachments. Currently in front of us, we have the revenue. So I'm going to go ahead and start there. And I apologize. So on our revenue projections here, you're going to see a listing of all of the various types of revenue fees that are being collected through the committee and that are being received. Currently, we have a year-to-date amount of about $296,000, and we're projecting that we're going to increase that to about $555,000 by the end of this year. And those, of course, are going to be based off of our fiscal month 6 projections. And so that's going to be basically all of the actuals we've received from July through to December, so through the month of December. And so our other attachments, we also have a page on expenditures, which I can go ahead and go through, and I apologize if that's not able to get displayed. This will be the fund condition. So this is the third page. And so on, there we go. That is, so our first page is going to be our expenditure projections. And this is going to be a general overview of that, basically that 6 months worth of expenditure data that we're tracking. And so currently you'll see a breakdown of our personnel services and operating expenses and equipment. And with personnel services, looking at our salaries, our benefits, and all of those similar types of expenditures, we're looking to project out about $271,000. Now, these are based off, again, FM6 projections, so July through December. But currently, year to date, plus encumbrances, we have spent about $123,000. So we are expecting a bit of an increase towards the end of the year. The separate second section of that, the operating expenses and equipment, that's going to include all of your general expenses. So paper, in this case, we also have attorney general fees, all of those travel, those all land in this operating expenses and equipment. And current year to date, we actually look about spending about $130,000, but projecting to the year end, we're actually expecting about $134,000. So not nearly the same growth as the personnel services. We do expect a decline. We went ahead and for display purposes, there's also $1,000 we notate in reimbursements. And so that has a projected total expenditures for year to end, based off of FM6 projections of about $404,000. Now on page 3, it's a nice high-level overview. It's our fund condition statement. And this utilizes those two tools to kind of build out, basically using our historical and our ongoing projections. And so our fund conditions are going to be based off of prior year all the way through to budget year +2. And we read these from left to right and top to bottom. And so you'll see the first previous year, which is that PY, that we had a beginning balance of about $455,000. There was a small adjustment, so that actually gave you a total adjusted beginning balance of about $451. And so that's what balance is currently in the fund. And so based off of previous year revenues, we had about $534,000 in revenues. And I apologize, the fund condition is in thousands. I do apologize. So we look at about $534,000 in revenue for last year. And with expenditures from last year of about $357,000, we actually have a fund balance of about $628,000. So you'll see that there's a slight increase. So we do have a little bit of added reserve there, which is always great. So with that beginning balance, we start at the top again with our current year. And so our beginning balance moves up there to that $628,000. As the beginning balance doesn't have any prior year adjustments since it's our current year, which is our 21-22 fiscal year. You'll see our FM6 revenue projections are incorporated into this document. And so we build in that $555,000 in revenue. And looking at that plus our expenditures, which is a total of $445,000, again, we're looking at about a $738 reserve balance. When we build out our future years, it's just important to note that we project out full expenditure. So your appropriations are being noted as fully expended. Another important note is that we actually build in about a 3% contingency, as it were. So we add about 3% into your expenditures as you go through your annual increases, as similar to like a cost of living assessment. We build that in as a little cushion to help support any ongoing increases to the fund. And we also went ahead and built in the general salary increase that was started impacting about 2 years ago. With the overall impact of the revenue and expenditures and building out those projections, we're looking at a 2024-25 fiscal year of about $1 million in reserve. And that's about a 29.4 month in reserve balance. And just a general overview of months in reserve, that is the amount the committee can afford should no other revenue be collected. So if we, at that point, collected zero revenue of that year and continued with our expenditures as projected, we would be able to continue the committee's activities for about 29.5 months. Now, I went ahead, these documents are provided, but I'm also available if you have any questions or anything you would like me to go over in addition to that. Thank you.
Thank you so much for being here. Members, are there any questions? Oh, Dr. D'Amico has her hand raised. Dr. D'Amico.
Hi, yes, I have 2 questions. First is, if there's a different place to address this, let me know. But I know we've had a little bit of movement in our staffing, and Rebecca, we had a temporary staff person. Is that person now gone? But are we budgeting for an additional person, or how does that work?
So we did have a temporary help that was being paid out of just our bottom line budget. because we don't have a line for temp help per se. So it was just taken out of our bottom line budget. We have reinstated, of course, the current salary for our current analyst, and that'll be, provided moving forward. But we do not have any other staffing funding right now. If we brought on additional staffing, we would have to request authorization to do so.
So we've discussed this yesterday with the legislature. Does that require them to allow us another staff member, or what is the process?
There are some processes that we would have to go to offline, and that would we would have to justify the reason that we need additional staffing and augmentation if that was needed as well.
Okay. And also, as part of this whole sunset review process, I became aware of the Attorney General's fee increase should we need to do an investigation, which it seems, I believe we're doing one now. I don't know if they're involved. But what happens, we've run a very tight budget. We haven't spent a lot of money, but the increase is so significant that it would potentially severely impact the budget. So how does that work should that become necessary, Renee?
Absolutely. In regards to the Attorney General costs, we do have an opportunity to do an augmentation, which means we can go ahead and request additional appropriations to utilize for that current fiscal year. Based off of what we're currently projecting, we do have a very small amount, about $2,000 we're expecting in reversion. So we haven't quite moved forward with that, but that is an option that is open to any board, bureau, committee, or program.
Okay, so we're not in stone. We have a little bit of, we have things we can recourse to if we need to. And just as a reminder for all of us, am I remembering correctly that the ideal target for months in reserve is about 26 months?
That can always vary for each fund. 6 to 12 is usually appropriate for most general funds, but as long as there's no statutory requirement, that can have a little different depending on the fund itself. In this case, 6 to 12 is always very healthy. I do see that we're well above that amount, so we are in a very good spot in regards to the health of the fund.
Thank you. It doesn't look, we're not going to get in trouble if we have too much, are we?
There's always the option of that, but based off of where we're projecting things to go, if we do increase and get an additional position, that's going to impact our overall expenses throughout the ongoing fiscal years. And so depending on how expenditures go forward, there's a chance that reserve actually may decrease.
Okay, thanks so much.
All right, Paul, that projected reserve will decrease.
Thank you. Yes, it's my understanding that while we do have a large reserve right now, because of the increase in the Attorney General fees and the potential increase in staffing, that's not likely to be long-term. So we'll probably fall a little more closely within the 12-month reserve in the future. Are there any other questions? All right, seeing that, I'm going to ask for public comment.
And this is the moderator. We've opened up WebEx's Q&A feature to facilitate public comment. If you have any comments or questions about the budget report, you can look for the question mark inside a box, typically at the lower right corner of your WebEx screen. Or if you're on a mobile device, it's behind the 3-dot other options. Or if you are a call-in user, you can hit *3 to raise your hand. If you're using the Q&A feature, type the word comment into the text box and click send, and we will take comments in the order received. I'll give people a moment to locate that feature. And I do not see any requests for comment at this time. Shall I close the public comment feature?
Please do, thank you.
Thank you.
All right, do we have the regulations unit staff here with us?
So there's no regulation staff today. I will be providing the update for the regulatory status.
And are you also going to be doing the sunset review report update, Rebecca?
Yes.
Then I think this would actually be an excellent time to take a 10-minute break before we step into those. I just didn't want to keep any DCA staff that was on the meeting unnecessarily. So why don't we take a 10-minute break, reconvening at 11:29, and we will move on to those reports. Thank you. Do we need to do another roll call vote to make sure everyone's back?
This is Sabina. That would be preferred. Just a real quick check in with everybody.
Quick roll call. Rebecca, can you do that?
Absolutely. All right, I'm going to go ahead and take a roll call. Dr. Thompson?
Present.
Dr. D'Amico?
Present.
Dr. Singleton? Dr. Singleton? We will come back to Dr. Singleton. Dr. Mukherjee?
Present.
Thank you. Dr. Davidson?
I'm present now. I just want to mention I will have to log off at 12:30.
Okay, thank you so much for that. I believe that we've already taken action on all of the actionable items.
Yes, great, thanks.
Thank you so much. Dr. Yoon?
Present.
Thank you. And Ms. Shirley Worrells?
Present.
Thank you so much. And Dr. Singleton, do we have you online?
Yep, I'm here. Thank you. I'm
Perfect.
present.
Thank you so much. It looks like everybody is back on and we have quorum.
Excellent, Rebecca. So do you want to move on to agenda item number 10, the regulatory update and status report?
I mean, upset is preferable. All right, absolutely. Thank you so much. The regulation packages are coming along. Staff have been working on getting documents for the packages prepared and ready for legal review. The IV and advanced therapy requirements. This package was pulled back by the request of the committee due to stakeholders having objections to the proposed language, and the package was pulled for further work. Language to be considered, reconsidered, and pending at this time. The fees regulation package is currently being completed by staff and is on our schedule for this completion for this year. Inactive and retired statuses. Both of these packets are awaiting the fees package to be completed. Both are the plan to complete both of the status packages while the fee packages is being reviewed for legal. Section 100 cleanup, repeal application processing times, language for repeal on June 4th, 2021. The committee approved the language and drafted to move forward as of June 17th, 2021. This was under review by the regulations unit, and on June 18th, the edits were returned to the regulations attorney. The staff will work with the regulations unit to determine what is needed to get this package submitted. The military temporary licensure, AB 107. This package right now is in the concept stage, so I will provide you more information about that as we move along. Are there any questions about the regulation packages that we have right now currently under the committee? All right, seeing none, I will go ahead and put this back to Chair Thompson. Thank you.
Excellent, and I see our moderator has opened for public comment.
Thank you. If you have a comment on the regulatory update, you may do so by clicking the question mark icon typically in the lower right corner of your WebEx screen. And in the text box, type the word comment and hit send. If you are on the mobile device, the Q&A is behind the 3-dot other options. And if you are a call-in user, you can press *3 to raise your hand to make your comment. Each commenter will be given 3 minutes to speak. And I see no request for comment. Shall I close the public comment feature?
Please do.
Thank you.
And the next item on our agenda is agenda item number 11, the Oversight Sunset Review Report Update. We just had a hearing yesterday, and Rebecca, would you like to give that report?
Sure. So I just wanted to provide a little bit of a just kind of feedback of the review that we had yesterday. The testimony went very well. We had some questions, of course, from the Joint Committee members, and it appeared that the hearing went well. I received a lot of positive feedback after the hearing. So thank you so much for Chair Thompson and Vice Chair D'Amico for being there and providing support for the committee. We sent out a copy of the responses to the background paper to all of our committee members. You guys all did your part in providing feedback on those responses. And since I have sent out a completed copy of that response to all of the committee members, and if you can just provide me with feedback to make sure that everybody is in agreement today, then what we can do is we can go ahead and submit that background paper to the Joint Committee and then await any further follow-up questions from them. Are there any questions?
I also want to make sure everyone's had a chance to look over the final paper before we send it off, and that there are no edits or additional comments on
that. This is Dr. Singleton. I have a quick question. Compared to previous sunset reviews, how would you compare this session versus others? I know that there's different sets of issues that come up, but are they fairly the same from session to session, or are they very different?
They are, the process in which it happens are normally the same. This year, of course, because of the pandemic, of course, we're having it virtually instead of down at the Capitol as we normally would have in the past. So basically, that is the only, that and some of the programs under the Department of Consumer Affairs have had their sunset date moved out as ours was. But sorry about that. But other than that, there are no changes to the process. We seem to have very good feedback. The hearing went well in terms of just the questioning that we were being asked to respond to, and it doesn't seem like there were any types of opposition at that time. There were a couple of public comments, several of support, and there was one that was just a little concerned about some of the title protection issue items.
Mm-hmm. Yeah, I was present on the Senate hearing yesterday. I thought you guys did an excellent job. Well, I'm just curious in terms of, and I don't know if this is the right time to ask this question, but I'll ask anyway. In terms of, the issue around title protection, I know that it's brought to the table, and I forget which representative had the question about, the costs related to the oversight and that sort of delegated to the process of policing. I think that's a bad word. The unlicensed activity. So is this something that is this something that can be brought to light, or something that can be taken action upon from our perspective, or from their perspective? In terms of, we offered some suggestions in terms of alternate titles, and then the gentleman came on and had, dissenting comment. So who sort of makes the final rule in terms of, whether we get the title protection or not?
Sure.
Does it come out as a result of the sunset review, or there is another hearing that needs to take place?
Yes, so there will more than likely be a couple of other hearings after this. Of course, as any bill, once they put in the proposed language to our bill, our sunset bill, then of course it goes through the same process as any other bill would. So if there's anybody that's in opposition or in support of that bill, they will have the opportunity to make those stances. And of course, we don't want anything that is very contentious in a sunset bill, only because we, of course, want to continue our regulatory efforts and enforcement efforts of our licensees. So in the past, if anything is suggested or recommended by the legislature that may be a little contentious, what they would normally do is recommend that a bill be looked for in another avenue after sunset, and they will make those recommendations. And then moving forward, of course, we will have any opportunities to respond to any further feedback or inquiries that the joint legislature has for us in response to the background response that we submit. And then, of course, it'll go through budgets and, all that. So each house will have, side of the house will have a hearing about the bill, and then, of course, the budget. So, yeah, same thing as any other bill.
Okay.
All right, thank you. And it looks like we cannot take action on the response to the background paper. I got a little bit of inaccurate information, so I apologize. We were advised that as long as you guys all advised me that we were okay with the sunset responses, that we could submit them. However, it looks like we will need to actually agendize that and do this again. So, hang on a second. I'm gonna ask our legal to chime in on this. Sabina?
Good afternoon. I was just trying to track the update report. The sunset review report. Has the report changed since the last time the board approved it?
No, the sunset report has not changed at all. The responses to the background paper is new.
Okay.
We did do the response to the background paper, and that it needs to be submitted within 30 days of our hearing date, which was yesterday. So that is kind of what we're, yeah.
Right. So we'll have to get the board to approve that.
Okay, so we will have to have another, sorry guys, we'll have to have another meeting just to approve that language in the response.
This is Dr. D'Amico. We can't do that as part of the review report update.
No, although it says that all items under our agenda are actionable, they do like us to provide a notification to the public that we are going to take specific action on certain things. So just to provide that notice properly to the public, let's go ahead and just jump on another meeting here in the next, I would say 15 days, because I have to have 10 days to post this. And we'll just jump on for a quick yes to the proposed responses and get that back out.
Yes, so this is Sabina again, and as it is agendized only as the review report, the agenda item would have been more appropriate to be the background responses or whatever the title of that document is.
Great, thanks so much. We'll go ahead and make that change and get that on an agenda notice. Thank you.
And I believe Dr. Yoon has a question.
Yes, thank you. I just wanted to know whether or not is the language for the bill, is that going to be written based off that background or the entire sunset review?
I
I'm
believe the
sorry.
bill is the entire sunset, which includes the previous language and the background questions, correct?
That is correct. It will be the entire Doctors Act or Naturopathic Doctors Act, and it will have changes or amendments or any additions that they see fit.
Okay, so legal is going to work on that, and then it's going to come back to us for approval. Is that correct?
So what happens is after the joint committee decides to make any changes to that text of the bill, then at that point, anybody, including us, can take a stance of support, I hope, on that bill language. And then if there's anything, of course, that we don't agree with or any other entity does not agree with, then of course they can bring up those concerns at that time as well, just like any other bill.
Okay, perfect. Thank you.
You're very welcome. And I will ensure that that is brought to you guys as soon as I see any language changes for proposed language.
And Dr. D'Amico?
Yes, Rebecca, there were a few changes I talked to you about yesterday that are not reflected in this document. Do you have those in a more updated version?
Yes, I do. I actually updated it on my end, so I will, and it was just a couple of the little grammatical errors. So yeah, I'll make sure that those periods and everything get put in there and sent out to the committee as a whole.
Thank you.
So committee members, make sure when you get this final corrected version that you look over it in detail and are ready to vote on it at our next brief meeting, because we do have a really short timeline on this. So we do need to make sure that if any changes need to happen, that they are done quickly. Thank you.
Perfect.
And I'd like to call for public comment on this.
And this is the moderator, and we've opened up the Q&A feature of WebEx to accommodate public comment on the Sunset Review report. If you have any comments or questions, you can look for the question mark icon in the lower right corner of your WebEx screen or behind the 3-dot other options on the mobile app and type the word comment in the text box and click send. If you are a call-in user, you can push *3 to raise your hand. I'll give people a moment to locate the feature. And I see no request for public comment at this time. Shall I close the public comment feature?
Please do. Thank you.
Thank you.
All right, this time we're moving on to agenda item number 12, which is the legislative update. Rebecca, are you giving this, or is this coming from somebody else?
Yes, I'll be providing the legislative update today.
Thank you.
No problem. So I'm going to be going over 3 items that you guys may want to keep tracking as we move forward in this legislative session. AB 2685, the Naturopathic Medicine Committee Sunset Bill, SB 994, the Vocational Nursing Direction of Naturopathic Doctors, and AB 1733, State Bodies Open Meetings. AB 2685, introduced by the Committee on Business and Professions on February 18th, 2022. This is the committee's sunset bill. This bill will be used to make any amendments or additions to the current Naturopathic Doctors Act. This bill is in current state this bill in its current state is a placeholder for additional language for the Naturopathic Doctors Act and will change greatly in the weeks to come. Of course, the committee should watch this bill closely as the legislative session advances. SB 994, introduced by Senator Jones on February 14th, 2022. Existing law, the Vocational Nursing Practice Act, provides for the licensure and regulation of vocational nurses by the Board of Vocational Nursing and Psychiatric Technicians of the State of California. The Act defines the practice of vocational nursing as the performance of services requiring those technical manual skills acquired by means of the course in an approved school of vocational nursing or its equivalent. practiced under the direction of a licensed physician or registered professional nurse as defined. This bill would revise that definition to additionally include practice under the direction of a naturopathic doctor. Existing law, among other things, authorizes a licensed vocational nurse to withdraw blood, administer medications, and start and superimpose intravenous fluids as described, when directed by a physician and surgeon. Existing law also authorizes a licensed vocational nurse to perform certain tests and immunization techniques as described when acting under the direction of a physician and surgeon. This bill would authorize a licensed vocational nurse to perform the above described actions when acting under the direction of a naturopathic doctor. It is important to understand that this bill will not broaden the scope of either the ND or the LVN. Although this is a sponsored bill by the Professional Trade Association, it is believed that this would provide additional protection for the consumer by allowing NDs to employ healthcare staff at a higher level than that of a naturopathic assistant that is not allowed to do some of the more technical treatments in the ND's office. For this reason, it is the recommendation that the committee provide a supportive stance on this bill. And before I advance to the next one, are there any questions about SB 994? Okay, doesn't look like I have any so far, so I'm going to go ahead and move along. AB 1733, introduced by Assemblymember Kirk on January 31st, 2022, would make changes to the existing Bagley-Keene Open Meetings Act. With meetings being held remotely during the pandemic, many boards under the DCA noticed a benefit of having meetings conducted on the virtual platform. The waiver of in-person meetings allowed more public access by removing travel barriers for consumers and stakeholders. There was also noticeable decrease in travel costs expended on hotel, airfare, and rental costs for meeting rooms. Due to the benefits of this bill, it is the recommendation that the committee provide a supportive stance on this bill as well. Are there any questions about any of these bills? Okay, well, as they move forward, we will definitely keep you posted on any changes to the proposed language and any concerns, areas of concern for them as we move forward.
This is Dr. D'Amico. Can we take a position today?
I do believe so. Sabina?
Yeah, this was agendized as an update without the possibility, it does not indicate that you possibly may have been taking a position on any of these bills. I would err on the side of caution on that because it is only as an update, and that if you're a member of the public who are reading this, they wouldn't know that you potentially would be taking a position on it where they could have some public input.
Can we please add that to our next quick meeting agenda?
Absolutely.
Thanks.
Thank you. At this point, I would like to call for public comment.
And this is the moderator. We've opened up WebEx's Q&A feature to facilitate public comment. If you have any comment on the legislation update, you could open up the Q&A by clicking on the question mark inside a box icon, typically in the lower right corner of your WebEx screen, or behind the 3-dot other options if you're on a mobile device. Or you can, if you're a call-in user, press *3 to raise your hand. And in the text box, type the word comment and click send. We will take commenters in the order received. Each person will have 3 minutes to speak. And I do not see any requests for comment at this time. Shall I close public comment?
Yes, please do. Thank you.
You're welcome.
All right. Our next item is the social media plan update. We have Renee Santos from the Public Information's Officer at the DCA Public Affairs Office here to speak. And then Dr. Singleton, are you also going to be providing an update at this point?
I think so. I think the content that Renee will provide should cover what was discussed. Unless there's anything further that I need to add, I'm happy to.
Okay, well, let's ask Renee Santos to speak now, and then Dr. Singleton, you can always add something in at the end if you feel like we need to, expand on anything. Welcome, Renee.
Hi, good afternoon. Introducing myself, Renee Santos, Public Information Officer with DCA. One of the goals for NMC was to enhance our social media presence, and which is why I put together this strategic social media communications plan to assist with social media outreach in general. Now, the objective of this outreach plan is to create evergreen messages, essentially messages that have a long shelf life, messages that can be shared throughout the year. They can be shared on Twitter, they can be shared on Facebook, they can be shared on Instagram if we decide to create an Instagram account, but these messages would relate to licensees, consumers, and applicants. If we can move over to the next slide, it'll show our target audience, which then describes the licensees, the consumers, the applicants. Moving over to slide 3, this will be done strategically by creating simple and impactful social media posts. Those posts will be supported with graphics. Now I have my ability, I apologize for that. So these posts will be supported with graphics that enhance NMC's messaging. These can be created in both English or Spanish. We also want to ensure that these posts do fit engaging interaction. So things like, did you know, TBT, which stands for Throwback Thursday, or fun facts mold that also educate and engage consumers in a fun way. They can also be created with important statistics. Now, our department has created 5 graphics to assist with this outreach plan. Today, I'll be showing you in depth 2 examples, and then I'll be kind of going through the other 3 examples just so you can get an idea of what these messages will look like. The first message reads, it's important for consumers to verify a naturopathic doctor's license to make sure it is valid and in good standing before visiting the doctor. You can verify an ND's license by using the DCA license search tool, and there you will see the website to where consumers can access that information. Another example is this second one here, which the message reads, did you know naturopathic doctors treat infants to senior citizens, people of all genders, and those in all stages of health and disease? Naturopathic medicine can benefit people who prefer a natural approach to their healthcare. To learn more, you'll see the website there. And essentially, these messages will just go along with the graphics that we have created. And I'm going to skim through the other examples that we've made as well. So let's lower that. So here's another example. Again, these messages will go along with the graphic, can be shared on all various social media platforms, and can be shared throughout the year. So they don't necessarily have a time frame. So how will this be implemented and promoted to ensure there's a greater presence on social media? Well, in addition to timely posts, those that do have a specific time frame, these evergreen messages will be shared 3 times a week on NMC social media platforms. We've also started writing blogs that can also be shared on social media. Here you see an example of a blog that was written last month that describes the difference between a licensed naturopathic doctor versus a naturopath. So there is a tentative time frame to get the ball rolling on sharing these important messages, but ultimately once they are approved, they again can be shared throughout the year. No time frame from that. We can also schedule out these posts to where we're not having to go in and post them on our own every single day. We can have a schedule put in place to where at a certain time, a certain day during the month, they can be shared on social media. And essentially, again, these are shared year round to just kind of help the social media presence and also hopefully engage consumers, educate licensees, and then tie in information that is timely and important to get out to the community. And that is it. Any questions?
Thank Thank you, Renee, for that. This is Dr. Singleton. Thank you for that summary. I think that really does encapsulate sort of the timeline and content that I had given you. I think you did an amazing job with, capturing it and making it really succinct. I think that it's excellent. Thank you.
Thank you.
Yes, thank you so much for coming and for all the work you are both doing. I think this is really vital for us as a profession because public awareness is so key for the naturopathic profession in California. So just a note of appreciation. At this point, I would like to call for public comment.
And this is the moderator, and we will be opening for public comment on the communication plan, the social media plan. If you'd like to make any comments or have questions, you can look for the question mark icon and in the text field, type the word comment and hit send. If you are on a mobile device, the Q&A is behind the 3 dots, other options. And if you are a call-in user, you can push *3 to raise your hand. And I do not see any requests for comment at this time. Shall I close public comment?
Yes, thank you.
You're welcome.
So at this point, we are moving on to agenda item number 14, which is future agenda items and next meeting dates. We already have 2 future agenda items noted, which we will need to find a meeting date very soon to address, and those are the approval of the, I'm so sorry, I'm going to phrase it incorrectly, the comments on the sunset review, and then also our stance on those legislative issues. Are there other future agenda items that people want to make sure are on upcoming meetings? You can always, of course, contact us in the future. Dr. D'Amico?
I noticed when we were reviewing the minutes from October of last year that we had the World Naturopathic Federation educational standards that we were going to look at. And I know we're in the middle of sunset. I would like us to have that on a future agenda, maybe before the end of July, if possible.
Great. Rebecca, can you add that to our list?
Yep, got it.
And I would suggest that we try scheduling our short meeting while we're online here, because that often goes quicker for Rebecca. And do you think that it's advisable that the subcommittees can meet and we might be able to put a review of the recommendations for the minor surgery subcommittee on the next meeting after the next one? 2 meetings forward?
As long as there's enough time to post and hold that public meeting prior to moving forward. Although none of our subcommittee meetings have ever come to a recommendation within 1 meeting, so it's probably not going to happen in 1 meeting, but we can definitely start getting those subcommittees convened to meet. Absolutely. And just for transparency, I've also added the review of the Genesis Medical College for the IV therapy training provider application on the next meeting as well. Not the short meeting, but the next full meeting.
Thank you. And you'll be reaching out to the 2 subcommittees that need to meet to get that going as soon as you can.
Absolutely. I'll send a Doodle pull out today for them, for those.
Awesome. Thank you.
You're welcome.
So yes, Dr. D'Amico, I completely agree. I think for the subcommittee, so as not to, take up the time of a bunch of other people that aren't on the committee to schedule, we'll let those schedule offline. But if we can get our next meeting scheduled today, because we have such a short timeline on that, I think Rebecca had said about 15 days out so that we can get it posted in time would be perfect. But we do need to have it within 30 days of the 7th. So we're looking at potentially either the end of the week of the 21st through 25th of March, or during the week of the 28th of March through the 1st of April. I will just start by stating that Tuesdays and Thursdays are significantly better days for me personally, but I won't make anything work, especially for a shorter meeting. It shouldn't be too challenging. What are other people's restrictions?
So just FYI, the March 23rd and March 30th, both I have full day meetings with FNMRA and then with the agency on the 30th. So those 2 days are not going to be good for me, but the other days of the week are perfectly fine.
And this is Dr. D'Amico. We're talking about 15 minutes here, correct?
Give or take, yeah.
Thanks.
Well, we did add 2 things, the approval of the sunset language and also the stance on the legislative issues. So I could see that taking closer to 30 minutes.
Sure.
What about Thursday, the 24th? Does anyone have an issue on that day?
I'm free.
Is there anyone
in the morning? It's good.
Yeah, is there anyone who couldn't make a meeting at 10 a.m. on Thursday, the 24th? That's in March. Everyone's available at that time? If so, let's just schedule it.
Okay, sounds good.
Sorry, is it possible to move it to 9 a.m.?
I can do 9 a.m. Is anyone else have a conflict at that time?
I can do 9 a.m. as well.
Hi, Rebecca. This is Michael Canotes from the legal division. I'm not available that day, but I'm not sure where we're going to be in terms of your coverage at that time.
Okay, yeah, and I know that we're going to be transitioning over to Michael as our legal, so I definitely want to make sure that we are allowing him the opportunity to check his calendar as well. So I think if Michael is not available on Thursday the 24th, let's look at the Tuesday the 29th or the 31st, which is Thursday.
The 31st is a holiday. This is Sabina. If we need to get it scheduled and done, I'm happy to cover the 24th for Michael if we're already in the middle of that transition.
Okay. Anybody have any objections to that?
I think given the timeline, we should probably grab it since no one else had any conflicts that day.
Okay, sounds good. Well, we will go ahead and put Thursday, 3/24/2022 at 9 a.m. on our schedule for the next meeting, and that is going to be to cover the response to the sunset background paper for review and approval, and for stance on AB 2685, SB 994, and AB 1733.
And I would recommend that everyone, if you're able to block your schedule for a full hour to allow for logging on, logging off, any issues. But we do not anticipate it to take that long.
Correct.
This is Sabina. Can I just get one more clarification? I swear you just said the 22nd, but I wasn't sure if we were talking the 24th or the 22nd again.
The 24th, Thursday, the 24th of March at 9 a.m.
Perfect. Thank you.
Wonderful. And then we are going to work on the subcommittees offline. What about our next full meeting? What's our timeline on that, Rebecca?
So the next full meeting, I'm sure we can probably go ahead and do that sometime in the middle of April. That will give us a little bit of time to get some subcommittees up and meeting. So maybe they'll have a little bit of information to provide during the next full meeting of the committee. So I would hope that maybe the week of the 11th of April or the 18th, either one of those 2 weeks would be enough time to have some subcommittees meet prior.
I'd like to suggest April 19th in the morning.
Does anybody else have any issues with the 19th?
Just a reminder to everyone, especially those people with kids, that April is the time when a lot of spring breaks are happening. So just checking your schedules on that to make sure there's no conflict. Looks like we don't have anyone who has a conflict, so that would be Tuesday, the 19th of April. Generally, we start at 10 a.m., logging on at 9:30. Does that work for everyone?
Works for me.
Great, let's just get that scheduled.
Okay, sounds good. So I have April 19th, which is a Tuesday at 9:30, will be online, and the meeting will start at 10 a.m. And then I also have March 24th, which is a Thursday, and starting at 9, and we will be online at 8:30. I will send a doodle poll out to the members of the subcommittees to get something scheduled for the first week of April.
Sorry, are we assuming that April 19th will be a full day session?
That is correct.
Okay, thank you.
Uh-huh.
All right, wonderful. So if other agenda items come up, please do reach out to Rebecca to make sure they get on the agenda. Remember, we need a full 10 days prior in order to post them if we're going to add any agenda items. And I do want to thank everyone for making time to be here. We're going to call for, do we need to call for public comment on this particular agenda item, Sabina?
On the future agenda items, that would be public comment. Yes.
Okay, so I am going to call for public comment at this point.
And this is the moderator, and we are opening the Q&A feature of WebEx to facilitate public comment. If you have any comments on the future agenda items or future meeting dates, you can locate the question mark in the lower right-hand corner of your WebEx screen, and then in the text box, put comment and click send. If you are on a mobile device, the question mark is behind the 3 dot other options.
I just wanted to mention that if SB 1733 does not pass, we will need to meet in person come April, and we may have some issues with budgetary for travel. So I'm going to keep a real close eye on that. We may need to cancel that if for any reason SB 1733 fails.
Thank you, Rebecca. When would we expect to have that information?
I'm not sure. We'll keep an eye on it and just watch it as it progresses. I just don't know, but I know that March 31st is the last day of that waiver, and I don't believe that there's any options right now that waiver is going to be extended at all. So if SB 1733 does not pass prior to April 1st, then we do have to make in-person meetings.
This is Dr. D'Amico. Should we ask if everybody could meet in person on that date?
It's not the fact of people being able to meet in person on that date. It is whether we have the budget for travel for airfare for people from Southern California to make it out here.
Is that not part of our budget normally?
We have, for the board members and for travel, we have already expended those line items. We've only had a handful of members, so now that we're starting to be fully staffed with our members again, it is starting to cut into the budget. And this year, because of the budgetary need for bringing on temporary help, it just really left us with a very, very small reversion. I believe it's only about $1,500, and I don't know that that's going to cover all of the airfare and travel per diems.
So we borrowed from travel to cover other needs.
That is correct.
Okay. I'd just like to say that since we anticipate having at least 2 new members on our committee this year, I would really like us to have an in-person meeting this year if we could. I don't know if we'll have the money. Just to have, we haven't seen each other in person for over 2 years now. I think it would be good to just have that contact.
Sure. And just as a reminder, our fiscal year starts July 1st. So our new budget goes into effect July 1st. So it won't be a problem after June 30th. But until then, we have to be very mindful of what we're spending, especially with a reversion this small.
Keep that in mind for a late summer or fall meeting, perhaps.
Perfect.
And Rebecca, this is Dr. Vera. May I ask why an in-person is needed for this particular discussion?
So Bagley-Keene Open Meetings Act, there are certain requirements that have to be met during the pandemic. Some of those requirements were loosened up with a waiver. That waiver is about to expire on March 31st, 2022. And after that time, we have to revert back to the Bagley-Keene Open Meetings Act requirements.
I see.
And this is Sabina. You can do a teleconference meeting, even if that law doesn't pass. You would just have to put your location on the agenda, just like we've done in the past. So it's not impossible. We don't have to travel. We would just have to make sure that you have a location on your agenda that can be open to the public. So your office, library room, something where a member of the public could attend in person if they would like.
Right.
And this location would have to be in the state of California, just so that I'm clear.
Correct. And it also has to be ADA accessible. So all of the things that we would have requirements to meet here at one of our locations would also be required at a location that any of our members has elsewhere besides the meeting place here in Sacramento.
And we do not have any public comment requests at this time. Shall I close the public comment?
Thank you so much. Yes, I did want to bring us back to that. All right. So it sounds like we've had some discussion about future meetings and what's going to be required, and that's all a little bit in flux depending on this this regulation issue. So we will be kept abreast of that, but we do have our future meeting dates. I want to just gonna stop my video for a second and just say it was great to see you all. Thank you for taking the time to attend our meeting of the Naturopathic Medical Committee. I am now adjourning it. It is March 8th. It is 12:17 p.m. Stay safe. We'll see you soon. Thank you.
Thanks. Thank you, everybody.